Welcome to H&HN Daily. I'm Susanna Hopsolin, Senior Editor for Hospitals and Health Networks magazine. In the hospital setting, being able to detect minor changes in a patient's condition can prevent a critical event, such as a stroke or heart attack, and even save someone's life. A patient early warning detection system can alert staff to clinical deterioration early on and enable them to engage in preventive treatment to improve outcomes. Today, I'm joined by Dave Bobrick, Clinical Informatics Project Manager, St. Joseph Mercy Oakland in Pontiac, Michigan, to discuss the Patient Early Warning Detection System. Welcome, Dave. Thanks for joining us today.
Thanks for having me.
In designing this Patient Early Warning Detection System, what was your goal?
The goal of our Patient Early Warning Detection System was to reduce mortality rates. And to do this, we monitored our patients and looked for early warning signs. Based on those early warning signs, we provide intervention for the patient to reduce critical events.
So, how does the technology work?
The technology works. We've added some components since we've last applied for the Innovator Award. One of those components is our Visi mobile device, which continually monitors the patient's vital signs. It looks like a iPod mini, sits on the patient's wrist. It captures the patient's 5 vitals. Those vitals are blood pressure using a technique called pulse arrival time, captures the patient's respiratory rate, pulse oximetry, and body temperature. It sends all those vitals wirelessly to our electronic health record, and then we developed a bidirectional interface from our electronic health record to our Vicensia monitors. Our Vicensia monitors calculate an index for the patient, and that we refer to that as our wellness index. The wellness index reflects the patient's hemodynamic wellness. So it ranges from 0 to 5. If the cell says 0 to 2.9, it's shown in a green color. It indicates that the patient is doing well. If it's 3.0 and above, 3.0 to 5.0, it's highlighted in red, and alerts are notified to our nurses on the unit, and we also have alarms that are associated with those 3 to 5 range patients.
How did you decide what information was really the critical information that was going to be actionable for the nurses?
When we worked with our vendors, this was only used in a critical care unit. So what we wanted to do was see if there was any value in taking this to a med-surg unit, a less critical unit where the vitals aren't continuously monitored. So that was the focus of the project, was to see if there was any value into monitoring the patients continuously. Just coming together with our clinicians and finding out what would help them. Our electronic health record, and most electronic health records out there, you have rows and columns of data. And it's hard to reference those data cells and show trends and how they relate to each other just by looking at the chart. And so this tool helps combine that into a single value and makes it real easy for the clinician. Green, 0 to 2.9, the patient's doing well. Red, 3.0 to 5.0, we need some action on the patient.
Were the nurses at first skeptical that this was going to be a useful tool?
I think whenever you implement new technology, you're always faced with some barriers and some resistance. But it was really working with our leaders on the unit, having them try the device themselves and test it at their home, see what their feedback was. And then from the very beginning, we brought our leaders and staff into our design meeting. So I think the staff giving their feedback during the entire process helped alleviate some of those concerns because they had input in what we were implementing.
You know, how did this change the patient outcomes?
It's greatly changed our patient outcomes and how we practice today. We've proven that we've reduced mortality rates by 35%. Our code blues have been cut in half. Our RRTs have increased, so we're acting on what the tool is displaying for us. And our case mix index during that 4-year study has increased by 22%. So the decrease in mortality rate is that much more powerful.
Thanks for joining us today.
Thank you. Thanks for having me.